Welcome to our video about clotrimazole for nail fungus. Surgical removal of an infected nail may be necessary for a chronic case of toenail fungus. The healthy nail will grow back, but chronic infection may require permanent removal. The recurrence rate is approximately 40%, so it is important to take preventive measures. In addition to regularly washing your feet after swimming, you should also wear shower shoes in public places and avoid wearing wet socks or shoes. Always dry your feet after using a shower, and disinfect nail clippers and home pedicure tools to prevent toenail fungus from returning. Symptoms: if you're experiencing a fungal nail infection, you may have a couple of different options. The best way to get rid of toenail fungus is to treat it early. If the infection is mild, treatment options include topical medications and oral remedies. In severe cases, however, it's better to see a doctor. There are several options available, including surgical removal of the infected nail plate. To diagnose toenail fungus, visit a physician. Your doctor can check the infected toenail and will probably perform a lab test. Your doctor may also take a sample from your toenail, either clipping it or scraping it under it. Once a diagnosis is made, the doctor will prescribe the proper medication. Some people may also experience similar symptoms of other conditions, such as bacterial infections and psoriasis. If you have a fungal nail infection, the nail can appear white, yellow, or brown, and the skin may be crusted. The nail bed may also be dry and cracked, and the nail may be swollen and oozing pus. If you can't find an accurate diagnosis, your doctor can order lab tests to determine the specific cause of your infection. To avoid spreading the infection, be sure to keep your feet clean, and don't wear shoes that make your toenails look dirty. Fungal nail infections are caused by various types of fungi that live on the surface of the skin and on the body. Because they thrive in warm, dark places, fungi can spread to the nails. If you're barefoot, it's not uncommon to get infected with this condition. As you can see, there are a number of different treatments for toenail fungus. Conservative treatments may be enough to get rid of toenail fungus if you have a mild case. Infected nails can be treated with antifungal oral medications, topical solutions, or nail surgery. If the infection is severe, however, you may need to have the infected nail removed and the skin surrounding it treated with chemical products. These measures may take months to work. Treatment options: for extensive cases, a doctor can prescribe oral antifungal medications such as clotrimazole, Clomid. These drugs are taken orally, and they work faster than topical medication to eliminate the infection. The drugs can take anywhere from 6 weeks to 2 months to fully cure the fungus. Toenail fungus is more resistant to oral antifungals, though, so it is best to consult with your doctor before beginning any treatment. To make a diagnosis, a doctor will typically take a small sample of the infected nail and look at it under a microscope. He may also scrape a small section of the nail bed to grow a fungus sample in a culture. Depending on the stage of the infection, the doctor may decide to start a different type of medication or refer the patient to a dermatologist or podiatrist. Because foot conditions can mimic a fungal infection, a doctor may recommend the use of an antibiotic. Several side effects are associated with toenail fungus treatment options. In some cases, a person's liver may become unable to process the medication, which can cause an irregular heartbeat and skin rash. The side effects of oral antifungal medicines are similar to those of topical solutions. Despite their lower effectiveness, oral antifungal medications are expensive and often require multiple applications. Some medicines interact with oral antifungal medications, including clotrimazole, Biaxin, and erythromycin. Over-the-counter antifungal medications may be helpful for mild to moderate cases of onychomycosis. Topical agents are rarely effective for moderate or severe cases of onychomycosis. Some people may also turn to home remedies for treating toenail fungus, such as tea tree oil, coconut oil, and Vicks VapoRub. The first step in treatment is to identify the type of fungus causing the infection. The treatment should be based on the fungus type and its symptoms. The first treatment option, clotrimazole, can help you get rid of toenail fungus without a doctor's prescription. However, it is important to use it as prescribed and under close medical supervision. Side effects: while the side effects of clotrimazole for nail fungus are minimal, the medication itself can cause some unpleasant side effects. These include stinging, burning, and redness. People who are pregnant should consult with a doctor before beginning the treatment. Another possible side effect is skin irritation, such as redness, swelling, or bumps. However, these symptoms should subside after a few days. The drug does not have any known interactions with other medicines, but it is best to tell your healthcare provider about any other medications you're taking. Always keep your medications out of the reach of children. Make sure you use a prescription strength product only if it is indicated for toenail fungus. The side effects of clotrimazole for toenail fungus can also occur if you're allergic to certain food or drinks. Another side effect of clotrimazole for toenail fungus is skin irritation. If you're allergic to clotrimazole, you should not use the medication. The drug's non-medicinal ingredients are benzyl alcohol, cetostearyl alcohol, cetyl esters wax, and 2-octyl-dodecanol. Clotrimazole cream is an antifungal medication, which belongs to the imidazole class of drugs. It prevents the growth of fungi and has other potential uses in the OTC market. Aside from toenail fungus, it's also used for other skin conditions. This cream can cause stinging and swelling. It is not suitable for people with severe skin irritation or sensitivity to it. In addition to the discomfort caused by the cream, some users report skin reactions such as hives, rash, or itchiness. They should wear loose, non-synthetic clothing to avoid any discomfort. People should avoid wearing clothing that restricts air circulation, as it can lead to allergic reactions. For serious cases, call your doctor or report the side effects to the FDA. Clotrimazole cream is used as a topical treatment. It is applied to the affected area twice or thrice a day, depending on the severity of the infection. The recommended duration is 2 to 4 weeks, with the cream applied to the infected area twice a day. For best results, use the cream 2 to 3 times a day. Cost. While you may be tempted to opt for over-the-counter toenail fungus medication, you should know that you are more likely to encounter side effects. While antifungal medications like Lamisil have been proven to be effective, they take time to work. While Lamisil is a relatively inexpensive treatment option, some patients should be aware that it can interact with certain medications. Luckily, there are several ways you can get your hands on Lamisil. While it is possible to catch toenail fungus in your own home, it is important to know that it is difficult to treat, and it is not a good idea to skip regular checkups. Moreover, the disease is notoriously difficult to treat and often fails because of the inability to get a proper diagnosis. Clotrimazole is not an immediate cure for toenail fungus, and you may end up taking several prescriptions to clear your infection. Aside from the cost, you should also remember to wear breathable shoes to prevent fungus infection. You should wear socks that wick away perspiration and prevent the skin around your nails from being in contact with the fungus. Another great idea is to wear sandals or flip-flops when you take a shower, which will allow your feet to breathe. To help you avoid any further infection, you should disinfect nail clippers and other home pedicure tools regularly. There are many options for treatment of toenail fungus, but prescription and oral medications usually provide the best results. You may also want to consider oral medications instead of over-the-counter drugs, which can be convenient but increase the likelihood of a recurrence. However, if you don't feel comfortable taking oral medicines, you can try homeopathic remedies. While there are some over-the-counter treatments, some are more effective than others. For instance, Jublia is a popular choice, but it costs 9 times as much as Penlac. And it only takes a few weeks to cure toenail fungus, so it's worth a try if you have a severe case. There are many other antifungal treatments on the market that work just as well for a fraction of the price. Thanks for watching. Please like, comment, and subscribe if this was helpful.